So when you're, come on, give me something, we're hemolyzing that whole sample. So let's not do that. So this is probably the more accurate way to perceive 3 milliliter syringes. It can, again, exert very high or very minimal to low pressure. Has anybody gotten more successful lab draws if the samples came back hemolyzed continued or repeatedly from the vacuutators? You guys use a 3 milliliter syringe and it worked better? Why is that? Less pressure because we are pulling more carefully. And we didn't know why. We just needed to be more careful this time.
Let's look at baseline to see what kind of negative pressure it applies.
So here's the negative pressure that our vacuutators applied.
So we got to about -4. Now let's see what happens when we pull it with a 3 cc syringe. Look at
-9 psi.
Now let's try with a 10 cc syringe. -13.
How many times have I done this trying to pull from that PIV because I was so mad and burned out?
How hard you pull is going to make a difference. I want you to watch how little the movement of the amount of syringe, how little of a pressure.
Unfortunately, I don't have the tools with me. Usually when I go to conferences, I have like these for you to play around with yourself. But this week, I just didn't have a lot of time to set it up. But the least amount of pressure possible will hemolyze your blood samples the least.
As slowly as I can to make sure I stay at 0. So how hard you...
So it is easier to draw with less pressure. And it's easier to draw with more pressure, okay? Just keep that in mind.